Today we are going to be discussing how to inject your insulin using an insulin pen. When you pick up your prescription from the pharmacy, it is possible that you will receive multiple insulin pens. It is important to store unopened pens in the fridge to ensure the insulin works to the best of its ability. Once you start using a new pen, you do not need to keep it in the fridge, but may store it at room temperature in a safe location. Some people choose to store on the counter, in a cabinet, or in a purse. However, the pen should not be exposed to very hot or very cold environments, like in your car. It should also be stored in a safe place away from pets and children, as it can be very dangerous if taken by someone who does not have high blood sugar. Because injecting cold insulin can cause a bit more pain, consider removing a new pen device from the fridge at least 15 minutes prior to injecting to allow it to warm to room temperature. To safely inject your insulin, you will need a pin needle, the insulin pen, and an alcohol swab to clean the injection site if you have some available. Wash your hands with soap and water prior to administering your insulin. If using an alcohol swab, gently wipe the skin around the injection site or make sure that it is clean in order to prevent any infection. Insulin should be injected into an area of fatty tissue directly beneath the skin as opposed to into the muscle. Many patients choose to administer their injections in their stomach, but some may use a non-muscular area on the outer part of the thigh or on the back of the arm. Because insulin absorbs differently in different body sites, it is important to select one area of the body and rotate your injection sites within that specific location. For example, if you inject on the right side of your stomach one day, inject on the left the next, or administer your injections in a clockwise fashion around your belly button. Avoid injecting areas within 2 inches of your belly button. This area of your body is more sensitive and more likely to cause pain. Prior to injecting your insulin, you should inspect your insulin. Remove the top of the insulin pen and take a look at your insulin. Some insulins will be clear and colorless, while others may have a cloudy appearance. Check with your provider or pharmacist as to what yours should look like. You will also want to make sure there is nothing floating in the device. If you observe this, discard the insulin and start using a new pen. To attach the pen needle, peel off the paper cover from the bottom of the pen needle. Place the needle on top of the pen and twist to the right or in a clockwise motion to attach tightly. Once the pen needle is attached, pull off the large outer cap covering the needle. Be sure to save this covering, as we will use it to discard the needle after completed. There will be another small cap covering the small needle tip. Remove this small cap to expose the needle and discard this one. After attaching the needle, but before injecting your dose, your insulin pen needs to be primed to ensure insulin will be released. Turn your pen to 2 units. Then push the button at the top of the pen. You should see a few drops of insulin coming out of the needle. If you don't see any insulin come out of the needle, prime it again with another 2 units until you see drops leaving the needle. Once the pen has been primed, use the dial at the end of the insulin pen to dial up insulin to your prescribed dose. You will feel a small click of each twist and also see a number in the window field. That small number in the window field correlates with the dose you are prescribed. Even numbers are usually indicated by a number, while odd doses appear as lines between the even numbers. Once the number shows your dose, hold the pen in your hand with a finger placed on the dial to administer your insulin. If the needle is small enough, you can inject the needle under the skin at a 90-degree angle. For larger needles, a 45-degree angle may be used to ensure injection into the fatty tissue and not the muscle. Check with your provider or pharmacist for your angle, which you should use with the prescribed pen needles. Press the needle into your skin. You likely will not feel the small needle entering your skin, but you should feel the pen pressing up against your skin. Once the needle is in your skin, push the button at the end of the pen and you will see the numbers decrease. Keep pressing until the dial reaches 0 and you cannot press the button anymore. Count for 10 seconds before removing the pen from the skin. Do not massage the skin once you take out the pen needle. Make sure to remove the needle at the same angle as it was injected to avoid bending it and causing pain. Once finished, recap the pin needle. Once capped, twist off the cap to separate the needle from the insulin pen. Discard the pin needle top into a puncture-free container, such as a laundry detergent container, a coffee can, or a sharps container you can purchase online or at a pharmacy. Once these containers are full, you can seal the lid with tape and put them in your trash or discard at a local facility. Do not use a pen needle more than once, as this can increase your risk of infection. You have now safely administered your insulin. Be sure to ask your provider or pharmacist about any additional questions that you may have.